So up until this point, I've read everything, but hospitals still print out, so I'm reading that as well. And this is probably nervous energy, because why am I primping? Hey, I'm home, recovering, resting. What was supposed to be two days has turned into 2 weeks, and I'm thankful. I'm going to share with you why. Um, the rest of this video is not going to be on me or about me. This is about you now, empowering you, giving you the tools to be the best advocate for yourself and to be able to be proactive. All right, so let's talk about it. Here's my disclaimer. This information is for educational purposes only. These are my opinions, my tenure in this field, and my experiences. I also want to honor sisters who have had a very challenging experience with fibroids and more, and have found yourself having to make decisions that worked best for you. What we don't do here in my business is critique, shame, and create hierarchies between traditional and natural methods. All right, let's talk. So within the United States alone, an estimated 26 million women between the ages of 15 to 50, that's reproductive age, have uterine fibroids. That's about 20 to 50% of women, as I said, in reproductive age. Now, by age 50, up to 80% of Black women and 70% of white women have fibroids. We know fibroids are non-cancerous. They are growths that develop in the uterus. They're also known as lyomas or myomas. So we know that all women don't necessarily have symptoms, but the number one symptom that has been documented, complained about by women, are painful menstruations and pelvic pain. Other issues would be infertility conditions, inflammatory disorders, and endometriosis. All right, this is what I want you to understand. This is what I spend a lot of time teaching about now. It's not just fibroids, but the behavior and the characteristics of them. If you have fibroids, ask your doctor for your labs. Ask your doctor what type of fibroids you have. So there are intramural, submucosal, subserosal, pedunculated, and there are often calcified fibroids, which means that the fibroids are degenerating and they can calcify and they can turn into these hard, non-cancerous masses. Fibroids feed on hormones, which is one of the reasons why Black women have a higher rate. We are very estrogen dominant. It is important that you know the size and the location of your fibroids. That also helps determine how you go about caring. That helps you to understand that you can't just listen to a generality of information. You have to know what your body needs from you. And if I can just preach here for a moment, allow me to say that this is why you have to know your body, your type of fibroid, your location, talk with your doctor and your holistic team, both of them, and determine processes that will work for you. Because for somebody, you could do the tea. For someone else, you could do a supplement. For someone else, you may need something more invasive. But this is going to be a matter of experience and really knowing your body and trusting your team. I'm having a submucosal fibroid removed. Those are less common. They bulge into your uterine cavity. They can create a lot of pain, also distortion in your abdomen area. And also, since I am in perimenopause, it has created pain that was not always there. I had immobilized my fibroids holistically many years ago, but listen, y'all, even that was hard. And you don't have to do holistic if you have tried and you don't feel like it's for you. I happened to do it. I would not go that route again because it was very vigilant. I enjoyed my consult with my doctor. I went through all of the questions, asked all of the questions. My doctor is great, so we had a very honest, candid talk. A few things that I asked her was about the likelihood of this fibroid growing back. Let me tell you the name of it. It's called a hysteropic myomectomy. That was the type of invasive procedure for a submucosal fibroid. So I did ask about the likelihood because fibroids do grow back, and I think that is the information that is seldom shared in the consults. So a note to empower you, make sure that you ask questions of what to expect after your procedure based on what stage you're in with your fibroids and what kind of procedure you're opting for. The benefit at my age and being in perimenopause is because my hormones are decreasing, the less likelihood of them growing back. I was like, yes, Dr. Thomas, let's get rid of this girl. I'm over it. I did choose to keep my ovaries and my uterus. And although I am not planning to have children, I am very content, 48, child-free with my husband. I want to just keep those girls with me for a little longer. And if I can ease into menopause successfully without any complications, they'll stay put. Now, in my consultation, I share with my doctor, listen, I know you've taken me through all of the things. You have checked all the boxes. I've asked all the questions. However, if when you go in, you discover something that was not expected and it is not fatal, I need you to go and get my husband, inform him, and let him be the person to make the decisions. Because a lot of times you don't see things in ultrasounds. They do help show the structures inside the body and they help to guide, but there are some things that a doctor, surgeon may not know until they go in. And she promised me that. And surely enough, by the grace of God, she discovered some extra things and she did exactly what I had requested her to do. I had already prepped my hubby. He has walked with me throughout this entire journey, as well as understanding more about a woman's body and perimenopause. So he was ready. I was really proud of him for that. Let me interject here as it relates to preparation, patient rights, and patient advocacy to always have your person, but have your medical power of attorney. So there's that. Listen, y'all, I don't play no games when it comes to our health, when it comes to my body and the importance of making decisions and being well equipped and well informed. And sure, maybe I am probably more vigilant as well because of the way that I lost my mother. My mother, I walked in to the clinic with her and walked out alone without her. So I know naturally I'm very vigilant about that. But as long as you've been following me, you know that I am a women's health advocate and I am an advocate for health equity. But my mother taught me to be proactive and my mother taught me to ask questions and my mother pushed my brother and I to have uncomfortable conversations. And so we, the women, the patients, have to make sure that we have our affairs in order as well. We're very demanding on doctors. We're very critical of them. But here's my challenge. How many of you have all of your medical papers in order, your will, your trust, your medical power of attorney? And for me, I don't care how invasive or how serious the procedure is. Anytime you're under anesthesia, you're going for any kind of procedure, operation, I take it serious. I truly, truly do. That's just the way that I work. We've got one time to live this life in one body. And so I hope that this empowers you. I hope that this helps you. I want you to have conversation with the women in your life, the daughters in your life, your grandchildren, the generations that are coming up behind you. And I wanted to use this as a great teaching tool. I am all about respecting my body. You don't have to push me to rest. I understand that it is my right to rest, and I will be doing just that. I am thankful to my doctor for also being vigilant within the process and catching the other discoveries that were found, and just the grace of God. So here's to our body. Here's to taking care of ourselves, right? So as I get ready to sign off, just remember to live, age, and be well and whole. I'll see you soon.